welcome to Let's Talk Health. Yet another episode today, and we are talking about UTI, Urinary Track Infection. I hope I am right. Karibu sana daktari. I am with Dr. Charles Wachihi. I'm literally having issues with pronouncing your second name, Daktari.
Yes, it's that kind of name. It takes effort.
Well,
yes.
We are sorry. We are very sorry. Karibu sana. Say hi to our viewers.
Good morning, good evening, viewers, wherever you are. Happy to be here. Sharing a few things about what I know, what I think I know, and hoping that it will be what you want to know also.
Yeah.
I'm hoping I will not give you too much info.
So, well, sit back. All I can tell you is just to sit back, relax, and learn from this bumper show. I guarantee you it's going to be amazing. Let's start with the basics. What is UTI?
Now, UTI, it's really an acronym that actually stands for Urinary Tract Infections. Now, so what is a urinary tract? So in this case, we're discussing, essentially, it's a system in our bodies that is used to produce waste, and remove waste from the blood, and it comes out through urine, right? Pee, if you would call that. And we all know what that is. So what does it consist of? So you have your kidneys that are really the start, the producers of everything. So the kidneys clean the blood of whatever they need to clean, and then everything comes out through our reproductive organs, through the urethra. It comes out as urine. And what does urine contain? All right? Maybe to add to that. So urine just contains everything that the body does not need. It could be medicine, it could be alcohol, it could be ammonia. So byproducts of all the cells in the body, whatever they are producing as waste. Some of it will come out as urine, right? So that's really it. And so in some cases also, the urine might contain something they shouldn't contain. Proteins, sugars, when you have disease conditions. So urine is it essentially shows us, it's almost like a window into the body. How our urine is, we say, is sometimes how our bodies are.
And many a times we get to perceive or even assume that it's only women who suffer from UTI, but we also have men who suffer from UTI.
Yes.
How does it present itself in both men and women?
I think, so when we think about the presentation of urinary tract infections, so we like calling it genitourinary infections because there's a genital area, and then there's a urinary system that it's higher up at the level of the kidneys. So, the commonest presentation you find, for both, first of all, for both men and women, is frequency, right? Because anytime you have, say, because there's a bladder, if there's an infection, there's a tendency to want to clear out what's in the system. So we find ourselves peeing a lot. So you find there's frequency, you're going to pee a lot, then there's pain, okay? Right? So that's the commonest. So depending on the extent to which it has gone, there may be fever, there may be, weakness. And sometimes these infections may ascend all the way to the kidneys. There may also be back pain, right? Back pain there, and then again more of the fever. So again, it depends on, and sometimes you might get infections that are actually the other way around. You find the kidneys are affected and not lower down. Now those are more dangerous because they're harder to diagnose. So in that case, a patient will come with just back pain, there's fever, there's weakness, there may be a bit of vomiting. So again, this is why you realize it's very important to seek prompt treatment. All right? And because of the genitourinary system, essentially, the only difference between men and women is in the genital area because the kidneys and the bladder and the rest are actually the same. All right?
So you mentioned something about urine, And when we talk about the color of the urine and blood in the urine, what does that mean?
You know, blood in the urine, normally you find one of them, blood is not a normal part. It's not a part of normal urine, right? So you find that for the most part, when you find there's blood, it just simply means anywhere in the system, from the kidneys to the urethra, there's somewhere there's production of blood. So there may be a break in the urethral part. There may be an infection going on. And so when we see blood, we're thinking, okay, where is it likely coming from? So you find that a lot of times, everything you see in the urine is not taken in isolation. It's based on what you've come, what you're presenting with, what signs and symptoms do you have, So I have to start thinking, is it the kidneys? Is it the bladder? Because we have to also start thinking about, based on what I'm seeing in the urine, is there cancer? Is there growth? It may not just be an infection. So blood could be many things. If sometimes you could be, like in a lady, it could be blood, menstrual blood. Sometimes it's crossed, because it's based on collection of the specimen. All right. Again, as I like saying, anytime you have any issue, see the doc.
So I don't know whether it's true, but do we have cases of UTI getting to affect the kidney?
Precisely. I mean, like as I said, so you find, so the kidney can be affected, from infection. Like for example, extreme cases, you might find an infection coming from down, bladder level, ascending upwards, right? Anything that is blocking flow of urine down through the bladder causes backflow, causes pressure on the kidneys. It might affect the kidneys. However, you mentioned UTI, the infection. Now, infection here, I think infection of the kidneys will come from any route. It can even come from the blood itself. Maybe you have a tooth infection, throat infection of any part of the body, bacteria getting in and affect the kidneys through the blood. All right. Then you also get so when we talk about kidneys, we like saying, let's not just think about from lower down, from the bladder and the genitourinary system. So to answer your question, you can get UTIs ascending to the kidney, all right, but kidneys are also affected from other parts. Yes.
So take us through how UTI would affect the kidney and what are the possible causes? Yes, for it to get to that point.
So in this case, we're talking about, in this UTI, let's think about what are some of the organisms that would cause UTI, So just to mention one of the commonest is E. coli, a bacteria that, so it's a bacterial cause. You can get causes from parasites and, viruses. So let's talk about bacteria. So the bacteria in this case, ascension from the bladder, maybe there's backflow, maybe the outflow issue is a problem, moving up. Bacteria are mobile, they're not static. You might be getting them up, up the ureter to the kidney itself. You might get, again, the genitourinary system, the bladder being the source of infection, it getting into the blood, ending up in the kidneys. You see, the kidneys, their work is to clean the blood. So while trying to clean the blood, it encounters a bacteria in the system. And that's how the kidneys tend to get infected while they're trying to do their normal duty, right? So sometimes you find, and so you see, you will not go see the bacteria itself and try and get into the kidney and see which bacteria it is. But it is possible to do a biopsy and see these things. Often not done. But the moment you see an infection, we sort it. So really, strictly, the UTI itself will go either direct or again through the blood, right? End up in the kidney.
Oh, so this is a question from a viewer. I was actually told to ask this question.
Yes.
She's a pregnant lady. She's been having reoccurrence of UTI in herself. She's gone for medication, but then it still comes back. What's up? And it's not like she has a sexual partner. She literally stayed away. What's happening?
So let's first understand. Urinary tract infections are not necessarily transmitted sexually. Because you can actually have a urinary tract infection and you're not sexually active. That's the first thing we need to first understand. Because we find there's a misconception that, oh, you've infected me with a UTI. Oh, this is, it's not strictly like that. Okay? You can have issues with, say, painful urination, and it's not sexually transmitted because of the anatomy. But for example, in a woman, you find proximity between the anal area, the vagina itself, and the urethra. Sometimes there's a cross contamination between those three areas, because the colon, the anal area, has a lot of bacteria. So you might get transference of bacteria from the colon to the urethra. All right? And it also depends on someone's, some people don't hardly take any water. So you might find bacteria ascending, up the urethra from the genital area up into the bladder. In ladies, the urethra is shorter, so there's a shorter distance for bacteria to travel. So maybe her water intake is not good. In pregnancy, the urine also changes, has a higher glucose content. Again, the bacteria tend to like that. So you find there are many things in pregnancy that would cause this, this repeated infections, if you would want to call that. And then it could also be ineffective treatment. All right? Someone may talk about repeated infections, but it could actually not be, maybe what kind of treatment she has sought. So I wish she was here. I would have asked her, where did you go for treatment? Did you get the right bacteria? And there's also a risk of resistance to some antibiotics. Why? Because of this rampant abuse of antibiotics. Everyone uses antibiotics unnecessarily, doesn't finish. So there's rampant abuse. So it could simply be she has the same bacteria that is not responding to infection. So when you have, that's why the importance of going to see a clinician and telling them, I've been treated, I'm not getting better. So they listen to you, and then they'll tell you, oh, let's do a culture. So there's steps we take. So it could simply not be a new infection, it could be so it could be many things.
Okay.
So it's a case by case basis.
Wow.
Yes.
So, a question: do you offer education on UTI, STI, everything, like the topics we have actually handled? Do you offer education in your clinic?
As you can tell, the education will come from a clinician, but you find it's very difficult for someone walking in and getting downloaded on information for 2 hours. What we do is it's on a case by case basis.
Yeah.
Like now, a patient like that, if she came to the clinic, would handle her with the issues she has, because we are there to sort out your particular issue and any issue we have. So yes, we offer education, but it's not routine education. It's almost tailor-made based on the issue you have. We discuss. It's part of treatment, because awareness comes from you learning.
Nice.
Yes.
So, what would you tell someone, preventive measures you'd give us?
In fact, preventive measures, first of all, before we think about preventive measures, what are some of the risk factors to getting the urinary tract infections? And I alluded to one. So they're not, first of all, they're not, so now the tricky bit here, a symptom of a UTI can be found with an STI. There are some sexually transmitted infections that will give you pain when you urinate. All right? So the differentiation normally ideally is really if you are able to type the bacteria. Okay? So like in a man, it may be difficult to differentiate between the two, because treatment might be the same.
The same.
Might be the same, because the organ is the same. I want you to see that part. And for the lady, you actually will have the same issue, pain going for a short call, amongst other issues. You might have pain going for a short call and no discharge. So you often find, in as much as we're discussing this, what makes it easy for us most of the time is that we differentiate it. If we really want to differentiate it, we do actual tests. We type them, we take samples, we take them to the lab, we do all those tests. So it's possible to differentiate. But now, from the treatment perspective, from a public health perspective, so that knowledge is good. But it's the awareness. The moment you have the issues of any pain when you're peeing and any discharge, just seek a healthcare consultation, and they will help differentiate between this. Is it an STD? Is it a UTI? Is it what? Right? When we are together, don't do it by yourself. But to prevent, so strictly for UTI, so in this case we are discussing something that is not sexually transmitted. So in this case we are thinking urine production. So we talk about, maintain your adequate water intake, keep the urine flowing. It helps with, essentially almost cleaning out the bacteria. And on top of that, it's just cleanliness. For ladies, it's about cleanliness. And really nothing much else, because the only other thing now is prompt treatment. That prevents subsequent issues. So you realize there is not much, because in this case, technically, you find you're not going to avoid, for example, if it's spread getting to the kidneys, for example, early treatment is what will help you, so that it's not spreading through the blood. So again, you find water intake is important, proper hydration, cleanliness of the system, so you get bacteria not getting to the system. And in case you have an issue, seek treatment early.
Very informative.
Because there is no vaccination, there's nothing I'm going to give you so you don't get a UTI. Those things don't exist. And if you have another condition, get that condition treated. And you see, we didn't go into details about other conditions that, for example, would complicate, this issue. And one I would like to mention is diabetes. It's very tough with urinary tract infections.
Wow.
Yes.
Very informative. Probably you give us your last words on UTI.
What would I say about UTIs? You can actually realize that at the end of the day, because the genitourinary system is the one involved, it can cause confusion with other issues that can cause problems, maybe conflict. So anytime you have an issue, don't make a conclusion by yourself. Seek professional help before you make any negative conclusions. Seek the help in a timely manner, and know UTIs are treatable on time when treated the right way. Thank you.
Wow. Don't make conclusions on yourself. Seek medical health. Very wise words to end the show, Dr. Ari. Thank you for coming.
Thank you.
I've been here with Dr. Charles. We've been discussing UTIs. Remember to subscribe to this video, share it with your friends, subscribe to this channel. Did I say this video? Sorry. Subscribe to this channel, share this video with your friends, with your families. We are all facing these issues. It's an issue we are going through, and silently we are not talking about it. Until next time, take care of yourself.